Hello people, in this video we want to look at facial nerve paralysis causes. Okay, the causes of facial nerve paralysis, but not just that. We want to look at the otological causes of facial nerve paralysis. So why facial nerve paralysis can happen? Because of ear. Okay, you understood now, right? So we are not looking at all the causes of facial nerve paralysis, just the otological cause, the causes because of ear issues. Okay, so let us start off. So look at all the causes of facial nerve paralysis and select the ear causes. Okay, central: brain abscess, glioma, poliomyelitis, multiple sclerosis. Do you want to select anything here? No. It could be, but anyways, brain abscess and all are complications of some otitis media and all, right? So anyways, we are not going to those. We'll go to the direct ones. Okay. Cause of facial paralysis in the intracranial part of the facial nerve. See, facial nerve has a lot of parts. So you have the central nervous system, intracranial part. Now, intracranial part of facial nerve, what could be the cause of paralysis? Acoustic neuroma. This is correct, right? Acoustic neuroma on the vestibulocochlear nerve, that is the cranial nerve 8. So yes, this is a cause. This can be a cause. Then congenital cholesteatoma, where it will be here. This you know. Meningioma, metastatic carcinoma, meningitis. All these meningitis and all are complications of some ear infections. But anyways, direct we are going. Acoustic neuroma, congenital cholesteatoma. We'll select these two. Okay, moving on. See, basically, are you getting what we are doing? See, facial nerve has many parts. It has intracranial part, intratemporal part, extracranial part, all that you have already seen in our facial nerve video, isn't it? So anyways, now we are trying to look at why facial nerve lesions or facial nerve paralysis can happen. So if it happens in the central nervous system, what could be the causes? If it happens in the intracranial part, what could be the causes? Intratemporal part, what could be the causes? Extracranial part, what could be the causes? So basically, in this, not just the causes, we are very specifically looking at the causes because of ear. Okay, so going back there, yes, here. So where are we here? So we finished this, then let's move on. Intratemporal part, this is the main one because this is where it is going very close to the ear, isn't it? So you have already seen in facial nerve video, intratemporal part, right? So intratemporal part of facial nerve, from the internal acoustic meatus till the stylomastoid foramen, this part of the nerve, if it gets damaged, it is very easy to say that it can get damaged because of the ear causes. So let's look at those causes now and let's try to identify. Okay, just look at these. The font too small for you. So infections, yes, ear infections can lead to facial nerve paralysis. Otitis media. So in that, many types they have put. Acute suppurative otitis media, chronic suppurative otitis media. What about herpes zoster oticus? See, oticus, O-T, the name itself says ear. So we will select this. So this also can be a otological cause of facial nerve paralysis. What about malignant otitis externa? Otitis again tells us the same thing, right? Otitis. So it's again a ear cause. Then trauma. Some surgery you did on the ear and you caused facial nerve paralysis. What surgery? Mastoidectomy, stapedectomy. So you try to remove the stapes bone. Stapedectomy, mastoidectomy, try to remove the mastoid hair cells and you caused facial nerve paralysis. Fractures of temporal bone. So can fractures of temporal bone lead to paralysis of the facial nerve? This fractures of temporal bone. Fractures of temporal bone can lead to tympanic membrane perforation also. Anyways, this if you want, you can keep as otological cause or not. Then neoplasms. Let's look at the neoplasms. Malignancies of external ear and middle ear. Malignancies. Yes, some cancer. Glomus tumor. Yes, glomus tumor. Glomus tumor will be where? In the middle ear. Basically, this benign tumor is glomus tumor is a benign condition. That's why they didn't include under malignancy. Malignancies, they have put separately, and glomus tumor, it's a benign condition. Facial nerve neuroma. Okay. Then, so we have highlighted all these as a possible cause of facial nerve paralysis, and in that we have tried to identify the otological causes. Okay. Moving on. After intratemporal part of facial nerve, what will come? Extracranial part of facial nerve. So malignancy of parotid. See, parotid gland though it is not directly, you can say otological cause, not because of the ear, but yeah, something near this ear. Parotid gland, if you want to include malignancy of parotid, and when you try to do surgery of the parotid gland, you could have injured the facial nerve, because you know how the facial nerve goes via the parotid gland. So here's your parotid gland. So facial nerve is like branching through this parotid gland, so it's very easy to damage the facial nerve. Okay, then injury in parotid region, obviously. Then let us see what is next. Systemic diseases which can cause facial nerve paralysis: diabetes mellitus, hypothyroidism, uremia, polyarteritis nodosa, Wegener's granulomatosis, sarcoidosis, Herforth's syndrome, leprosy, leukemia, demyelinating disease. Okay, so we have not marked anything here as a otological cause. Okay, so now let us take a recap of what and all we think are the otological cause of facial nerve paralysis. Ear, because of ear. So we saw that it can be acoustic neuroma, congenital cholesteatoma. You can just say cholesteatoma, whether it's congenital, acquired. Then acute suppurative otitis media, some ear infections, right? Herpes zoster oticus, Ramsay syndrome will come here, right? Then malignant otitis externa. Malignant is sudden, right? Sudden otitis externa. Malignant otitis externa, actually, because it can be, or necrotizing otitis externa, it can be because of Pseudomonas infection, right? Especially in immunocompromised people, diabetics. Anyways, each of these we have separate video. Then surgically you can mention mastoidectomy, stapedectomy, fracture of temporal bone, if you want you can mention that. Neoplasms of the middle ear and external ear. Always you see some tumor in the middle ear, external ear can cause facial nerve paralysis. Glomus tumor, facial nerve neuroma. Then parotid gland also you blame off a little. Malignancy of parotid, surgery of parotid, accidental injury in parotid region. Okay, so now finally we will come to the summary. Otological cause of facial nerve paralysis, all this you have to write. Otitis media, cholesteatoma, acquired or congenital. So how does this cholesteatoma come? Because of this retraction pocket and all that, right? Then mastoid cavity infections, malignant otitis externa, non-cholesteatomus, chronic suppurative otitis media, again otitis media itself, tuberculous mastoiditis, suppurative parotitis, and chronic granulomatosis. So here are the otological causes of facial nerve paralysis. Add a few more here and there. What and all you can add here? Acoustic neuroma, glomus tumor. So many things are not there here, but from the previous sections you can add them here. Okay. So in this video we looked at the causes of facial nerve paralysis and we try to identify the otological causes, okay, of facial nerve paralysis. That's all for now. Bye bye.